All right, thank you everyone for joining today. My name is Ryan Bessemer. I'm the Director of Growth for Strada Healthcare, and we are going to talk about COVID testing and some initiatives that Strada's taking. I am here with my father, Dr. Joel Bessemer, and he's going to be taking most of the medical slides on today's deck, and then I will talk a bit about some more administrative things that we're doing. Quick housekeeping, this is a webinar format, so if you do have questions, please use the Q&A box and submit them. We'll probably just take them at the end rather than taking them as they come in, but just submit them as you have them. You can also use the chat feature as well. So our objectives today are to help you understand testing availability and cost, both to you and your business. Help you learn when you should be doing an antibody test versus a standard PCR COVID nasal swab test. Explain the varying testing cadences that we have conducted with a variety of different businesses and how they're conducting testing. And then finally, just talk about some reopening strategies that you may consider. Okay, I'm going to pass this off to my father to talk a bit about COVID-19. How the symptoms affect you and how we kind of start to think about what testing should look like.
Well, good morning, everyone, and thanks for joining us. COVID-19 has certainly been around long enough now. We're learning more and more each week, obviously. And so some of the comments you hear me make today, if you've listened to any of my previous webinars in the past, might be a little bit different. However, the slide that I'm showing now is one we would have used in the past with just some different notations. So notice that those days 0 through 5, and I always try to point out what day 0 means. Day 0 is the day that you were, quote unquote, inoculated with the virus. And so those first 5 days, most patients, almost all of them, are going to remain relatively asymptomatic. And it's somewhere through days 5 through 10 that most patients are developing symptoms. And then once we get out to about day 20, most symptoms are typically gone. You've got enough IgG around by then that you're clearing the virus, and most of the symptoms are typically gone. So that's, just an idea of typical response. And obviously the true numbers that you might hear from your friends could be all over the board. But I point this out just simply because it helps you better understand also then our testing and our cadence discussion and some of those kinds of things. And then also when you're thinking about testing and who to test, it's important to remember that the CDC will tell you that as many as 70% of the patients who get infected remain asymptomatic throughout the entire course of their illness. Having recently had a little bump of infections in my practice, I had 4 cases in the past couple of, at least in the past month, we've had 4 new cases, which total through my practice, we've had maybe 7 the entire time. And in the 2 of those cases, both of the patients were mid-60s to early 70s, and both of them were relatively asymptomatic throughout the process, with the exception of, feels like I have a cold. And that seems to be the most common presentation for this, is just cold signs and symptoms. So then when you think about testing, so what now you can see on this slide is I've tried to overlap the last slide, which shows symptoms, onset of symptoms, and recovery, with what we think about doing for testing. So oftentimes I've gotten called by patients, hey, I was at an event last night and somebody called me that they tested positive. Can I get in and get tested? Well, no, I don't want you to get tested yet, because those first 5 days that you're asymptomatic, it's difficult for you to have enough viral load that we may miss it if we go do PCR testing. So in the initial phase of the illness, we really would like you to be about at least 5 days if it's a known exposure, or at least maybe a day or so into symptom onset for us to do PCR testing. PCR testing, remember, is the nasal swab going all the way into the posterior pharynx. So I say we go tickle your brainstem and we try to identify evidence that the virus is in your posterior pharynx. Notice then that once the symptoms have really started to develop and we're starting to get clearance and recovery, that's when we can think about antibody testing. And that antibody testing then could go on for at least out to a couple of months to a year. Meaning after about those first 3 weeks, you're now already clearing your IgM, that initial antibody response. And by about day 20, you're starting to form that IgG, and we should find evidence of that. IgG is our efficient antibody that is going to come clear the virus and get rid of it for us. And it's also our memory antibody. So if you think about it in the way of the COVID vaccine that folks are trying to develop, when they look to say, hey, did you develop an immune response? What they're looking for is IgG. That's our memory antibody that then remembers the virus, and therefore if you get exposed again is what comes and clears it before you would ever develop symptoms. So that's a little bit about PCR testing, IgM and IgG antibody, and how we think about that timing, which then will better help you understand what we recommend from a standpoint of testing, when and why.
So one question we commonly get is, if I'm going to come in for a COVID test, let's say I had a recent exposure, the question is, should I get an antibody test or should I get a PCR test? If I'm bringing my employees back to work, what type of testing cadence should we go through? And so we've worked really hard over the last couple of months to put together what we consider to be our standard flow chart of how we're running businesses through. The first chart here that we'll talk through is for the PCR testing. And then secondly, we'll walk through what antibody testing looks like and when you should do this. But I would say that, every business case is going to be somewhat unique, but this is kind of our standard starting point for most businesses to say, if you're going to bring your employees back to work, this is a testing cadence that you should consider. So do you want to run through symptoms? Sure. And then PCR test?
Sure. So the symptoms are off to the right-hand side. And notice that the classic here is upper respiratory influenza type presentation. If you're looking in color as we are on the computer, you'll notice the starred ones in red, runny nose, congestion, and sore throat matched down below. And what I've tried to indicate there in the flow chart is that, hey, this is Nebraska and it is spring, summer, fall, and this is when a majority of us are struggling the most with our allergy signs and symptoms. So one of the things we've done in this work part is if you're a person who has allergy signs or symptoms and these are your only complaints, usually we recommend you take Claritin for several days, see what that does to your symptoms. But note that's only if there is no fever with these symptoms. Anybody who is febrile with runny nose, congestion, and sore throat, we should be PCRing. Anybody who's got fever, body aches, chills, cough, we should be thinking about PCRing. Those symptoms down at the bottom then, the diarrhea, nausea, vomiting, specifically GI symptoms, not very common in our adult population with COVID, seem to be more common in the pediatric population with COVID. And headache is one of those that crosses the spectrum for all of them. So that's kind of the idea of the PCR. So if you look then at the flow chart itself, somebody's been exposed or we have concerns, we do a PCR test. If they're PCR positive, that patient needs to be isolated for 14 days. Then what I talk about is those last 4 days of that. So days 10 through 14, we continue to do symptom monitoring. We continue to do fever checking. If they're symptom-free, fever-free, they're okay to go to return to work. And what I want you to understand is that's even a little bit more conservative than what the CDC recommends. But most of the employers we are working with want a conservative approach. Joel, please help us develop a way to get COVID out of our business. Please help us develop a way to keep COVID as much out of our business as possible. And that's what this flow chart represents.
One other case in this PCR testing would be if you want to test across the board. You want to talk about that?
Yeah. So sometimes for example, we've been involved with a Fortune 100 meat processing company here in our community. And when we went into that company, we went and screened a majority of their employees just at the beginning, and their employees tested at about 17 to 20% positive, depending upon which area we were at. In that case, what we want to do is we want to do a cadence of testing, because you'll notice up to 70% of the people can be asymptomatic. If you're asking us to get this out of your business and keep it out of your business, we have to screen a number of asymptomatic people to be able to pick them up and get them out before they're infecting other people. So the cadence we develop can be different for different employer groups depending upon what your ultimate goal is. If the ultimate goal is, hey, Joel, we want to identify those sick people early because they are the ones at most risk to pass the disease on, then there's some other things we can talk about through that. So next is the antibody testing. So this is interesting, and I want to point out from the very beginning the caveat off to the right there. So in the middle of taking care of that packing house and processing company, we were using PCRs and antibody levels in congruence in a return to work. And in the middle of that, you know, the Equal Opportunity Employment Group came out and said, it is against the law to use antibody testing in a return to work program. Now, what does that mean in English? You cannot, as the business owner, force your employees to go get antibody testing using those antibody results as a way to say it's okay to return to work or not to return to work. What I don't want you to take from this is that we can't use antibody testing as long as the employees are okay from that standpoint as a part of their own screening so that we know what is best to do. So how do we use antibodies to help us? First, it's understanding why we don't come back and do PCR again. Some employer groups had been going back and recommending repeated PCR, and then when the employee is PCR negative, it's okay for them to return to work. First off, PCR testing is more expensive. Ryan's going to talk about the cost in a little bit, but it's almost double the cost for us to do PCR. That is very exhaustive work in a lab to get those results. It involves a number of different reagents, a number of different steps, and takes longer to get done. And once again, is just more costly to do. That's one. Number two, we know very well now a number of individuals stay PCR positive despite the fact they are no longer infective. Let me explain that. In the back of your throat, we rub the swab. It does not tell us if the virus is alive or dead. It just tells us, is there evidence of the virus having been there? So it makes sense why some people take longer to clear. They maybe had more virus in the beginning, or they just still have an area where the virus is no longer alive, but it's there. We've picked that virus out as far as 65 days in clinical studies, despite the fact they were asymptomatic after that 10 to 14 day window. So then this is where antibody testing can come in. So then you get to around those days 10 through 14, they're asymptomatic. We would normally antibody test those. What that means, we draw blood. We send it to a lab, and inside the patient's bloodstream, we look for evidence of IgM and IgG. IgM is the initial antibody response. It's a great, big, inefficient antibody. It does not have memory. IgM indicates somebody's been acutely infected. So if somebody's IgM positive, IgG negative, that is early disease. We would not want them back to work, even if they were asymptomatic. We would then say, if we didn't have a previous PCR, I would start their time there then to say they need to be out at least 10 days, the last 4 being asymptomatic. Because remember, you're at least 5 to 7 days in if you're IgM positive. If somebody is IgM positive and IgG positive, then we're in the middle of the illness. They've probably had the illness for at least 14 to 20 days because we're picking up the IgG. And so if somebody has been asymptomatic for the last 4 days and their IgM is on the low side and their IgG is climbing or on the higher side, they're good to go back to work. If somebody is IgM negative, IgG positive, then this is somebody who's had it, has cleared it, and has memory of it. They're clearly okay to go back to work. So that's a little bit about how we use the antibody testing. And just a few personal comments as to why part of this becomes frustrating. This antibody testing that we have been using through the Strada is done by Boston Heart. It's the best available and has been tested and is fantastic. The reason the EEOC comes out with this is there's a lot of different antibody testing out there available, and a bunch of it is absolute crap. And so like our typical governmental response, rather than trying to go regulate the bad, it's just easier to regulate everybody. So they don't want to have to figure out what's good testing and bad testing. They're just not going to let us use any of it. That's the frustrating part in this, because antibody testing can be very helpful in a return to work program.
Quick comment before we move forward with this is turnaround time, both for the antibody test and the PCR test through Strada, runs between 48 and 72 hours. There are cases where we can get it in 24 hours. For the PCR test, it just depends on if regional pathology and UNMC are able to get their hands on enough reagent for us. But typically we're seeing 48 to 72 hour turnaround times. We also have agreements in place with employers and employees that we are able to share this aggregate data and specific data with you so that you can use it as necessary. All right, quick. So how can we help you? First and foremost, we have routine COVID testing. So just what we've been talking about. Strada's developed online sign up on our website. Employers are using this to schedule their employees directly on our site or have their employees schedule themselves. We are working with employers to either do on-site testing with them if we have enough demand, or we will just have them come drive through our parking lot in Miracle Hills. We're also offering this at our Des Moines location as well, with the same types of tests, with the same type of setup. From a pricing perspective, this is, my father mentioned that PCR is a little more expensive. So you should expect to pay $200 for a PCR test for an employee and around $100 for an antibody test. And again, that can vary slightly depending on whether we're on site or they're coming through a drive-through on our clinic. But you should expect between, around $200 for the PCR test, $100 for the antibody test. You can get the PCR test for free through the Test Nebraska site. I do want to emphasize that. The plus side is that, it's not going to cost you money. The downside to that is sometimes the availability, the turnaround time can be questionable with the state of Nebraska. We totally support the initiative that they're doing. Our setup is more for employers that want a more tailored approach, that maybe want to have a bunch of people tested at once on site. And have a specific program put together. So again, we are certainly not trying to compete with Test Nebraska from that perspective, but we want to have this available to employers that are looking for different options. So just know all the testing that we've discussed, we've got really good systems in place for reporting and for signups and scheduling and all of that. The second thing to discuss is our COVID hotline. So we have a 24/7 texting and calling hotline that we've been using for a variety of employer groups. The pricing on this is reasonable, I'll say, but it varies based on how many employees you have. We've been hovering around the $10 mark per employee. And again, this will cover any questions they have about their symptoms, any questions they have about getting tested, travel monitoring if they've been out of the state and they're coming back and they maybe have symptoms or don't. They're wondering if they should return to work. We've seen this as a really affordable and useful option for employer groups to say, hey, we've got this local company with nurses that are answering questions for you. You want to talk a bit, Dad, about case study that we're doing with this?
Absolutely. So the $10 is per member per month. Is kind of where we've fallen in most of those companies, sometimes a little less and sometimes a little more. But that would certainly be the average figure. And what that allows us to do then is us to take that off the hands of the HR inside your office. I mean, otherwise they're the ones that the employees are trying to, get the opinion of, is it okay to come back to work, all of those kinds of things. So we would then take all of that off. And as a matter of fact, even be a resource to the HR people themselves is what we have done. And along with that, we're really excited that I think we've got something coming in the near future here that may be even better. And that is we are working with a monitoring company that we think has phenomenal technology for symptom monitoring. And let me explain, that's different from what many of the other employer groups have been using. So the packing house that we were working with is paying a company to do all of their symptom monitoring. And what that means is they're basically paying somebody to call every one of their employees once or twice a day, depending upon where they're at in their infection, find out, are they febrile and are they symptomatic? And then they have just this algorithm that we help them develop that you can see that they would follow through. What I'm talking about for symptom management is true measurement of the symptom as opposed to asking the employee. And why can that be important? Well, let's say that as a part of the being sick, you can't return to work. And it may be for some of these employees, they're then not being paid. And you can imagine if that's the case and money is tight, it might be easier to say, I have noticed no symptoms. I want to get back to work. What we're talking about doing instead is screening employees for a temp when they come in. They actually put on a wearable device that looks just like an iPhone, or I'm sorry, an iWatch. And that device measures their temperature, their oxygen saturation, their pulse rate, and actually then can even be used in the long run if we would want to do a bunch of wellness monitoring. Measures their calorie burn, their step takes, all those things that you would be used to those wearables doing. So I'm really excited about that. And I think our price point is going to be very competitive. I think we would be able to do all of that with the device included for somewhere between $35 and $45 per member per month. And the difference there being, this now allows us to help pick up what might be those otherwise asymptomatic people, because not everybody becomes symptomatic when their temp is 100 degrees. And yet if they showed up for work and they were 98.6 and all of a sudden their temp is into the 100, this is going to go off. We actually know because it's live monitoring. We just set the alarms of what we wanted to be noted for. So some fun things coming, I think, that will be available to help us in the future.
Let me know, shoot me an email or just shoot a chat through if you want me to follow up with information on that. Okay, we are running up short on our time. I'm gonna ask that if you have questions for Dr. Bessemer, you would submit them now, and then he has to hop out of here in about 5 minutes. And I'll just run through these with you. In the meantime, again, reopening strategies. We're really encouraging people and businesses to keep your employees at home if at all possible. And if you do have to bring people back to work, consider phased approaches where you have maybe longer business hours, but have a smaller amount of people in the office at varying time with staggered shifts. Of course, the physical barriers that now are becoming a normal part of life, we would encourage you to put those up between employees when at all possible. As much as you can keep a contact-free workplace, please do that. And then as much as you can develop a periodic COVID testing plan, you should consider doing that. All right, we have a question. Is Douglas County spiking? If so, what do you think is happening?
So I think what you can see is we open things up inside, whether it's restaurants, whether it's athletics, or whatever you might, use as the example. We're obviously out and about much more. Travel has increased. And yes, we've seen an increase in cases. But what's interesting, that got announced, within the past couple of weeks. They've encouraged people to be more careful. And you can already hear on the news today that they think the numbers are already going back down again. And so I think there are a couple of things. First of all, this virus is not going to go away in the short run. It's going to remain in the community and it's going to trickle through, and you're going to see some ebb and flow in those numbers. And I wouldn't overreact to that too much from a standpoint of those things. But although I'm personally not huge on wearing a mask myself from a standpoint of times when I know I'm safe, I do want you to understand that I do think wearing a mask anytime you're entering somebody's 6-foot space is important and may be helpful. But I think the place that those masks can be most helpful and the things that we're doing can be most helpful is you're wearing the mask, and it's the reminder that you need to wash your hands before you then eat or consume.
Okay. And again, just an emphasis on, don't go about this alone. Feel free to utilize Strada as a resource to develop a plan that you can show your employees to say, here's how we're going to encourage a testing cadence as people return to work, especially with this hotline. If that's something you're interested in, then employees have a resource specifically on COVID that they can use anytime from local providers right here. And then, we're more than happy to develop strategies specifically for your businesses. So I don't see any more questions, so I think we'll wrap it up here. Our contact information is attached. You know how to get a hold of us. If there's anything we can do to help you make sure that you're doing the best to keep your employees safe, reach out to us and let us know. Thanks for tuning in today, everyone, and have a great day.
Thanks, everybody.